helping make your life easier. Moms Every Day.
Hello, everyone. Taylor Eaton here with Moms Every Day. We're glad you're here joining us. We are here with Dr. Kristen Simpson today, who's here with us from Simpson Dental Associates. Doctor, we appreciate you joining us today. We appreciate it.
Well, sure.
So today we're talking about some very important topics, and the first one being, of course, our oral health, and first of all, when it comes to our gums, because a lot of times that is something that we don't think about. So how does someone know if they have gum disease?
Right, a lot of times gum disease can go unnoticed because it doesn't hurt. So a lot of times the disease can be progressing and you don't even know you have it. And you know, a lot of times people think, oh, well, my gums always bleed when I brush and floss. Well, if they're bleeding, that means that's the start of the gum disease process. So bleeding gums is called gingivitis, which is the first stage of gum disease. And as the disease progresses, then you start to get bone loss, and you start to get mobility even of the teeth if you get too much bone loss around there. So it is important to make sure that you catch things early so that you can get it before you start to get to the bone loss stage. So, you know, when you have that bleeding of the gums, you definitely need to do something to take care of it. I mean, nothing else in your body bleeds when you clean it, so that means something's going on there.
Sure. And Dr. Simpson, can your gum health affect your overall health? That's something a lot of people wonder.
That's true, yes, and with all the advances in science, we found that, you know, your mouth is just a portal to the rest of your body, so they are definitely linked together. You know, once you get gum disease, the same bacteria and, you know, disease process can affect your overall health. So, you know, February is Heart Healthy Month, so we've talked about the link between gum disease and heart disease. So that same inflammatory process that's going on in your mouth can be linked to your heart. So as you're getting, you know, the progression of that disease, it is definitely affecting your overall health and can also be linked to things like cancers and arthritis and, you know, all kinds of different overall health concerns.
And I think a lot of times, too, we neglect our teeth. So like you just mentioned, very important to take care of them. So when you see someone come in who has gum disease, how do you go about treating them for that?
Well, what we do first is we do a bacterial test. This bacterial test lets us know what type of bacteria is in the mouth that's causing the gum disease. Once we know that, we know which antibiotic to use while we're doing the treatment. We do a deeper cleaning with a piezo scaler. It's an ultrasonic scaler that helps to get rid of that tartar that's below the gums that's causing that irritation. And then we come back and use a laser. It's a CO2 soft tissue laser that helps to disinfect the area, get rid of all the bacteria, and promote new tissue growth in the health. So, you know, we found by using this series of steps that we've gotten really good results with treating the gum disease and can mostly do it without surgery. So having that soft tissue laser and the bacterial test together really does help.
Now, Dr. Simpson, how often should people be getting their teeth cleaned?
Well, if you know, certain things that make you more susceptible to gum disease can, you know, make you need to come in sooner. So sometimes every 3 months is what you need if you have the susceptibility for gum disease. And certain risk conditions like pregnancy or diabetes. So, you know, you might need every 3 months, but definitely every 6 months. You know, twice a year is definitely the time frame that you should be coming in to get your teeth cleaned so we can check and keep things healthy and catch things early.
And what should people expect when they come to you to get a cleaning? What should they be expecting?
Yeah, so when you come to, say, for a new patient appointment, it's your first time at the office. You know, a lot of people can be nervous. You know, we make sure to meet the person before we even get them into the dental chair so we can establish a relationship. We give them a tour of the office so they know where they are and can be comfortable in the environment. We start with taking some pictures of their teeth so we can be able to diagnose any areas of decay. We do a real thorough exam on that first exam to make sure that we have all of the, you know, standard things that are in your mouth documented, and then we just clean your teeth. So it's a very thorough process for that first cleaning, and we establish that relationship, and then we hope to see you every 6 months after that.
Well, Dr. Simpson, thank you so much for joining us to talk with us today. Very important that you take care of your dental health. If you'd like more information, you can head over to WSAZ Mobile. Just click on the Moms Everyday tab. Thanks so much for joining us. Have a great day, everyone.
Sure.